Which of the following is least likely to occur associated with severe atopic gastritis? That means which is not a feature of the atopic gastritis. Options are gastric ulcer, gastric cancer, anemia, duodenal ulcer, and gastric polyps. So which is the least likely in case of the atopic gastritis? So first of all, let's see the atopic gastritis. It is a normal atopic gastritis. So what is atopic gastritis? Atopic gastritis, that means it occurs due to a antibody formation. Antibody here we can see a antibody formation against the gastric parietal cell. So the antibody formation occurs the antiparietal. Here we can see this is the antiparietal cell antibody or intrinsic factor antibody. So when there is antiparietal cell antibody or anti-intrinsic cell antibody, so what happen? The parietal cell cannot secrete intrinsic factor and parietal cell cannot secrete the hydrochloric acid. For this, there is a development of the achlorhydria, that means absence of hydrochloric acid, and there is the hypergastrinoma and the hyperplasia of the ECL cells, the dysplasia of the ECL cell, and neuroendocrine tumor may develop. On the other hand, there is the atopic gastritis, metaplasia, dysplasia, finally gastric cancer. So neuroendocrine tumor and gastric cancer develop. Also there is deficiency of the vitamin B12 and iron. Also there is anemia and neurological manifestation. So when there is the antiparietal cell antibody and intrinsic factor antibody in this condition, this is known as the atopic gastritis, and it causes different type of the peptic ulcer disease and also the carcinoma, and also develop the vitamin B12 deficiency and iron deficiency. So here we can see the autoimmune gastritis. In case of the autoimmune gastritis, there is the antibody formation against the parietal cell. It is known as atrophic gastritis, and it usually affects the body and fundus, and approximately 5% of the cases. And the what is the etiology? Etiology is autoimmune antibody formation against the parietal cell also, or against the intrinsic factor of the gas cell. And what occurs? The loss of the parietal cell and atrophy of gastric mucosa, achlorhydria, that means the absence of the hydrochloric acid, and also the hypergastrinoma. Finally, there is the cell hyperplasia. And what are the complications? Complications are vitamin B12 deficiency, iron deficiency, and the carcinoid tumor and gastric adenocarcinoma. That means the disaster develop in case of the atrophic gastritis. First of peptic ulcer disease develop, then carcinoma develop, vitamin B12 deficiency, iron deficiency develop, and in case of the iron deficiency, there is development of the pernicious anemia. And what is the treatment? Treatment is the vitamin B12 supplement. So which is the least likely in case of the atopic gastritis? Here we can see duodenal ulcer, because the duodenum is not depend on the gastric secretion. Other options here such as the gastric ulcer may develop, gastric cancer may develop, anemia develop due to reduced iron absorption, and gastric polyp also develop. That means in the stomach all type of pathology may develop due to the atopic gastritis, but in duodenum it has no role on duodenum.